So diffuse large B-cell lymphoma is one of the most frequent histological subtypes of non-Hodgkin lymphoma. We can cure these patients in a significant proportion with conventional chemoimmunotherapy strategies, but we have some patients that in spite of first-line treatment or eventually second-line treatment, they demonstrate to have refractory disease or relapsed disease. The standard of care in patients with primary refractory, secondary refractory disease, or patients with early relapse after autologous stem cell transplantation gives quite poor results in the long run. And this is why the introduction of 3 different CD19 CAR-T cell constructs some years ago made a kind of revolution in this field, and it significantly improved the long-term outcome of patients that otherwise had really very poor prognosis. So nowadays we have really consolidated data on the 3 different CD19 CAR-T cell constructs, both in efficacy and also in toxicity in patients with large B-cell lymphoma that had failed at least 2 prior lines of treatment. And this has made to move CAR-T cells into earlier lines of treatment. And nowadays we have the results of 3 phase 3 prospective clinical trials that compare CAR-T with the standard of care in patients with primary refractory disease or with early relapse. And 2 of these trials have offered positive results. So maybe in the future, we will be able to see CAR-T cells moving to second line of treatment outside prospective clinical trials in these patients.